coronavirus is hitting new heights in the state. We have just passed the grim milestone of 4,000 deaths. We have a record number of people that are currently hospitalized. I think it's important to keep in perspective here that when we announced as a state that we were embarking on this largely voluntary path, the Tennessee Pledge, there were about 168 total deaths in Tennessee. That's how many deaths have been reported in the last 3 days. The circumstances that we're dealing with have changed, but our approach hasn't. We've now been dealing with this virus for over 8 months, and we still don't have rapid, reliable testing. In my own family, I've seen, we received negative test results today from a test that was taken 7 full days ago. We still don't have the type of mask mandate that's been adopted by over 100 countries across the world and over 35 states in the United States. We still don't have a handle on how to stop outbreaks and significant numbers of deaths in nursing homes in the state. And as we sit here with hospitals across the state at full capacity, we still don't have a strategy to keep doctors, nurses, and health systems from being overwhelmed. For the last 8 months now, Governor Lee has rejected the approaches that have been adopted by virtually every government on planet Earth, and the approaches that have been recommended by every scientist and doctor in this field. And here we are on the verge of a nightmarish winter. And I think you would have to be a fool to not recognize that those two things are connected. Let me be 100% clear. I'm not calling on the governor to shut anything down. I am calling on the governor to do the work to keep things open. And right now that work's not happening. We have somehow adopted this mind-numbing debate between overreaction and underreaction. And I think Tennesseans want us to be smart and try to have a reaction that fits the crisis that we're in. And that's just not where we are right now. It's not really much of a success story if everything in the economy is open, but our hospitals are closed because they're overcrowded. It doesn't do me any good as a parent to have schools technically open and have half the teachers in quarantine. We have got to, we're at a point where we can almost see the light at the end of the tunnel with the amazing news that vaccines are appearing to be effective and might be able to be used, but we really do have to buckle down and figure out the way to keep as many Tennesseans safe and living through the next few months as possible. By the end of 2020, this virus will have taken the lives of more Tennesseans than lung cancer, than colon cancer, than strokes, than diabetes, than homicide, than suicide, than drug overdoses or car accidents. Just think for a second about how many laws we have to prevent any one of those things from happening. But when it comes to this, which is on track to be, the second or third leading cause of death in Tennessee this year, we have this opt-in voluntary public service approach like we're trying to stop people from littering. It doesn't meet the moment, and it's time to acknowledge that it's time for change. To me, this is also not about Republicans versus Democrats. There are Republican governors across the country that have had the courage to have mask mandates and other sensible measures in place since this summer. In the last 3 weeks, we've seen Republican governors who have never done it before adopt mask mandates for their states to deal with the crisis of the moment. Being a leader, sometimes it requires an admission that it's time to change course. And if you look anywhere in the state right now, you're seeing doctors, nurses, and families begging the governor to change course. And I'm begging the governor to start listening to them before it's too late for those families. I think in some ways the debate about which restrictions or which requirements or what steps is almost beside the point, because we really need to acknowledge that change has to happen. We have seen state after state, city after city go through many of these steps. I think we've had this debate in Tennessee since March, or at least since the early part of the summer. We know what works, and we know what's needed. And part of it is like, we've got to do the basics here. Anyone who's been looking at this virus has known for months that this time period was going to be the hardest. But we've been caught flat-footed and not being able to keep up with testing demand right now. It's shocking that we haven't been able to scale up just the basic rapid, reliable testing and contact tracing that we needed to. Almost every state, almost every country has mask requirements, has some reasonable guidelines and that are very clear for people about public gatherings. And we don't have that in Tennessee. And we need to stop this nightmare before it gets worse. And I think it's just, it's well past time for people to put kind of the nonsense discussions to the side. Like, this isn't a hoax. You can look in any community in America and any community in the state of Tennessee, and people are dying every week. That requires Democrats, Republicans, legislators, governors, mayors, people that are in the health system and people who aren't, to kind of put the nonsense to the side and start coming to the table and figuring out what we have to do now. But that's going to require, taking this seriously and acknowledging that we have to change course, because the strategy that we've been using thus far isn't working.